Hello everybody and welcome to Let's Talk Health on the national station of the CRTV. My name is Alice Esambe Tata. 50,000 children die every year in Cameroon from various forms of malnutrition, according to UNICEF statistics. Almost 40% of the population of children under 5 years old is at risk of vitamin A deficiency, with rates exceeding 62% in the North region. And acute malnutrition is hitting a 17% high in the country and well beyond the emergency threshold. The situation may get worse with skyrocketing food prices. We examine how malnutrition is a problem in Cameroon and the various interventions on course to fight the problem in this edition of the program. Malnutrition is a serious health problem even in its mildest forms. Dr. Adidja Amani is a public health specialist at the Ministry of Public Health. She explains what nutrition means and says there are two main types.
Malnutrition can be defined in general as a deficit in food intake, mostly in terms of quality. We have two main types. The first is called marasmus and the second is kwashiorkor. Usually in kwashiorkor, the child is obese with big feet. When you put your finger, you make a pressure, there's like a hole remaining. While in marasmus, the child is skinny. That's the main difference.
Many people think that one is malnourished if one does not have enough to eat. Is there a difference between underfeeding and malnutrition?
The difference between underfeeding and malnutrition is that in the case of malnutrition, there are certain type of nutrients, certain type of food that the child doesn't receive. So it's a more a quality kind of problem, while underfeeding may be the quantity. So you can eat everything, the meat, proteins, vegetables, everything, but just in small quantity. That's different. But mostly in kwashiorkor and in marasmus, it's linked to a deficit in the specific kinds of nutrients.
What percentage of the infant population in Cameroon is affected by malnutrition?
Almost 40% of children suffer chronic malnutrition in Cameroon, according to the UNICEF estimate. In northern Cameroon, global acute malnutrition, the deficit is like 115,000 children.
What areas in Cameroon are most affected by malnutrition?
Malnutrition is mostly in the North region, that include Adamawa region, North and Far North region, and in some way in the East region. However, there was a study made in 1998 by a pediatrician, Dr. Njiki, who shows that even children in the West region have malnutrition, but their kind is more like kwashiorkor-like. So the child is fat, he look normal because he has his normal weight, so you think that the child is normal, but he's undernourished, he has malnutrition, he has kwashiorkor. But in the North region, Far North and Adamawa is mostly marasmus, that's more prevalent.
Why is the northern area of Cameroon and a part of the East region, why are they vulnerable to malnutrition?
Because it's manifold. Mm-hmm. First of all, North region in general has a certain type of climate or certain type of... That means that there are certain crops that are not readily available for them. And sometimes we have like heat. Sometimes we don't have enough rain, so that in a year you can have crop failure. So it's the lack of access to food. There's also the cultural practices. In the Adamawa region, for example, women will do pap without groundnuts or soja or other stuff, just water and the flour, which is really poor. But when actually you ask them, okay, you should add peanut, you can add soya beans and all those, they are like, no, this will give skin problems to the child. So there's this problem of cultural practice, and that's transmitted from mother to child. Every mother there knows that you don't need to peanuts, you don't need to put soya beans, otherwise child will get skin problems and other things. So in the East region, however, there's an interesting pattern. You see that what they call delicacy or good food like eggs and the best part of the meat, they will say, no, this is not for children, it's for adults. Children need this type of protein than adults.
In the East region that you've mentioned, people live mostly on bushmeat, which is a source of protein too. Why should the children there be suffering from malnutrition when they have enough protein?
That's why I raised the cultural problem. Because it's available. It's not like in the north where you don't have the vegetables, the proteins. You have it. It's available. But because of the culture, they think that adults should have the best part. Children should not eat eggs and things like that. So that it's malnutrition. Above, there's always poverty in general. Of course, if you don't have enough money, even if you know what is required, you can always afford to buy what's good for the children.
The influx of refugee children from the Central African Republic and Chad is another significant factor. The children usually arrived at refugee camps not malnourished, but the circumstances under which they arrived easily lead to a decline in their health and nutritional status. Families that have been used to owning their own food tend to start depending on food rationing, and the fear of running out of supply is prompting many households to restrict the consumption of food. Lack of birth control is a push factor too, and Dr. Adidja Amani explains how.
You have women with 8 kids, 10 kids. From one pregnancy to another, you really don't have time, to take care of the 6-month-old baby. When you yourself, you are pregnant, sometimes ill, you have to be in the hospital at the same time. So there's this kind of challenge to the fact that
they're not spacing
out births, and they have a lot of kids. As you know, pregnant women receive supplementation with iron, all these vitamins to avoid this vitamin deficiency, malnutrition. But when you have just 2 kids in a row like that, or 8, even the mother is in some way malnourished.
I don't think that should be a great factor because in the West region, for instance, in Fumban, where the people have a similar culture to those in the north, they make many babies and they don't space out their pregnancies. But children in Fumban area don't suffer from malnutrition.
The problem is, in the West region, is the kwashiorkor that you mostly have. So you see children, they are all fat, you say, oh no, they are healthy. But, if you examine them, if you're a physician or a hard worker, you know that, oh no, this one, he's as fat as the other one. But it's not just about the size.
What are the signs and symptoms? How will a parent know that his or her child is suffering from malnutrition?
As I was saying at the beginning, macroscopically, that's physically, there's these 2 big patterns. So the marasmus is the child will be really tiny, small, and the kwashiorkor, you have like big feet. Apart of that, so the child, in the marasmus, the child look emaciated. There's obvious muscle wasting and loss of body fat. There's no edema. So when I was saying the kwashiorkor, there's no edema in the marasmus. The hair is thin and dry. And if you go to the north, you'll see most of the kids, this red, thin hair on the head. The child is apathetic. He's not jumping. He's not like other kids, like you say, this is an unhealthy kid that he has. And diarrhea is frequently associated. Mm-hmm. However, for the kwashiorkor kind of malnutrition, it occurs typically in young children displaced from breastfeeding, maybe by a new baby, like you were talking of, short birth. It's often precipitated by infection, sometimes measles, malaria, and diarrheal disease. There's a generalized edema. Edema, that means there's an accumulation of liquid inside the body that make the body look fat, but it's liquid, so we call it edema. So it's generalized and mostly on the lower limbs. And sometimes you have skin pigmentation. The hair is dry, sparse, and may become reddish or yellowish in color. You can see if somebody is healthy or not just by looking at the texture of his hair. So it's really, really important. And usually they have this distended abdomen. So you think, oh, he eats a lot, he's healthy. No, he's not. So, yes. And then we have other criteria. We need to draw blood, but this is not important. We are talking about physical criteria, yes.
Anemia, is it a problem in malnourished children?
Of course, it's always a problem because there's a deficit in this food intake. And the iron in the blood comes from, vegetables, protein, everything that we eat. So if you don't have enough intake because you have anemia, yes, anemia is frequent, not almost 98% of cases, yes, they're associated with case of anemia. Tena
Adequate intake of micronutrients, particularly iron, zinc, folic acid and vitamin A, from conception to age 24 months is critical for child growth and mental development. Children who are undernourished between conception and age 2 are at risk of impaired cognitive development, which adversely affects the country's productivity and growth. What are the effects of micronutrient deficiency on kids?
The effects of malnutrition on kids, they are huge. They are huge because we used to say in French that la jeunesse est le fer de lance de la nation. So if you have a child who is starting with malnutrition, who is undernourished, first he will have problem at schools because he will not have the same level of understanding as other kids. Not just because he has malnutrition, but because at a certain age, he needs some kind of special lipids, some kind of special nutrients for the brain, for everything. So if a child is malnourished, he will not perform as well as the child with. Another impact is the stunting. So you have this physically, the child will not be appealing and elsewhere. And again, this is not good for the economy. We just see the problem of malnutrition now, but the impact is huge, like the economy of the country, because if you don't have a productive population, a healthy population, you can aspire to be economically developed.
Studies have shown that 36% of Cameroon's children under the age of 5 are stunted, 16% are underweight, 7% are wasting away, and 11% of infants are born with low birth weight. With business as usual, there is no likelihood that Cameroon will meet the Millennium Development Goal number 1C, which is about halving the 1990 rates of child underweight by 2015. Dr. Adidja Amani says malnutrition is a government priority and the Ministry of Public Health is doing much to mitigate the impacts of the situation, supported by development partners.
The government, with its development partners and the community, are doing a lot. Huge efforts have been doing since to overcome the malnutrition problem. At the higher political level, the President of the Republic, His Excellency President Paul Biya, if you remember in one of his interventions, said in December 2003, aussi longtemps qu'un Camerounais ne mangera pas à sa faim, qu'il n'aura pas l'accès à l'éducation et qu'il ne recevra pas les soins auxquels il a droit, notre tâche ne sera pas terminée. So at the level of the presidency, it is a high priority, as I just said. And this high priority is also at the level of the Ministry of Public Health. The Minister of Public Health and the Secretary of State in charge of epidemics and pandemics are doing a lot of efforts to eradicate this problem. First, the Ministry of Public Health put in place what we call nutrition coordinators. So at the level of human resources, we didn't have this kind of position, but this has been created just to have people in the field, just to take it off the nutrition problem. And the government, with his collaborator, partners, the WHO, the World Food Programme, UNICEF, Plan Cameroon, have been doing in the past and continue to do a lot of efforts in health promotion of good feeding, and even delivery of supplements, like in the North area. We have what we call the plum peanuts that are given for free to mothers with kids. So it's a ready-to-use therapeutic food that contains a mixture of peanut butter, dry milk, sugar, and micronutrients that require no refrigeration, so it's so adequate for the North Bar region. And no need to be mixed with water, so it's readily available. So the government is giving it for free. And every month in the hospital, if you go across the hospital in the North region, you'll see that there's a free distribution of even flour, but enriched flour for free that the government and the partners are doing for the population. They also created what we call Centre Nutritionnel in certain hospitals in the North region. If you go to Yagua, you'll find a Centre Nutritionnel. If you go to Hôpital Regional de Mara, you'll find it. Actually, it's more than 20 nutritional health centers, so just to take care of malnutrition. That's a huge effort.
What kind of care is provided in these centers? Do they just give them education or they give them the food that they need?
It's a many-fold kind of intervention. First of all, there's a sensitization at the level of the community. You have at the level of ministry what we call a community health workers. So they are part of the population. So they go in the population when they see mothers, they try to talk to them to raise awareness, like, okay, you should breastfeed till 6 months. You should, and if you have these signs, you can go to this place. You can have this for free. You can have this for free. So population is sensitized in their community. Then when there's a problem, they can rush in anywhere in the hospital where we have Centre nutritional centers, and they'll receive free, plumpy nuts, free F75. There are so many that these are just the generic the names, but yeah, they receive free supplementation.
Does one size fit all in combating malnutrition, doctor?
What do you mean?
The children in the north, do they have identical problems? Is the malnutrition affecting them in the same way that they have to take the same food to solve their problem?
Yes, many studies have been done, and they came up with a consistent kind of nutrients that are lacking in those children. So the plumpy nut is made of these nutrient deficiencies. It was not just made like that, and we see that there's a consistency in which kind of ingredients, which kind of so are missing. So the plumpy nuts, everybody.
These interventions are laudable, but how far they will go to ensure continuity of food access is another question. The project is long-term, financed with short-term resources. Such projects tend to go to sleep when donor funds freeze.
Tena na mfungu amoja mabwaki yao. 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 Tena na mfungu amoja mabwaki yao.
Poverty comes to mind first when malnutrition is mentioned, but there is also malnutrition of excess, which occurs mainly in resource-rich countries. This highlights the fact that it is not only the issue of food access, but of caring practices and diseases. Dr. Adidja Amani sheds light on how malnutrition affects even the rich.
Malnutrition, as people may imagine, is not just the deficit, it can also be the excess. Actually, we mentioned the developed country, the high-income country, that's true. But even at our level, we have this kind of double epidemic. Mm-hmm. As we see obese children, well-nourished obese children in Yaoundé, we have undernourished children in the north as well. So what happened in the high-income countries is happening here. So you see children don't exercise, they took Diet Coke, they eat pizza, they eat shawarma, all these high fatty kind of...
Can you tell us
elements.
Briefly what kind of health condition this malnutrition of excess predisposes people to?
Excess leads to obesity, first of all. So you see a child with overweight. This overweight, actually in high-income country, as you pointed out, you have a 6-year-old kid with a heart attack. He already had hypertension. He has diabetes. So obesity will lead to diabetes, will lead to hypertension. And you have children with a heart attack at 6 years. Okay. That had happened in the U.S.
What is the way forward in solving malnutrition in Cameroon?
The way forward to solve this problem is mostly about advocacy. Advocacy for what? Advocacy for increased resources. According to the Abuja Declaration, the Ministry of Health should receive 15% of the national budget in order to meet the needs of this population. In Cameroon, it's around 4%. So this is not enough. So the problem is that if you don't have resources, you will be willing to give the company, you will be willing to send people to educate, but all this require money. So I think the next step is advocacy for increased resources in these programs, this area. And also, things go hand in hand. Poverty. How do you go about that? I don't have the answer on how to find solution to poverty. I don't. So, but at the level of the ministry, I think if we can have more fundings, I think you have a better impact to educate, to raise awareness, to continue the free distribution of supplements of food.
Solving the problem of malnutrition in Cameroon goes beyond money. Education and sensitization are also very crucial, even though health campaigns seem to be falling on deaf ears. In spite of the many campaigns promoting breastfeeding, for example, only 20% of all newborns receive breast milk, and 4 out of 5 infants under 6 months are not exclusively breastfed, whereas breast milk contains all the micronutrients a child needs, and it is cost-free. Families need to be aware of young child feeding practices and complementary feeding, for good nutrition is not just about adequate supply, but also what kinds of foods are provided to the children. That is the beat we had for you today. I am Alice Esambe Tata. Send us your comments and suggestions to alicetata@yahoo.com. Thanks for listening and goodbye.